Hello, my name is Olga, and this is my channel about startups. And today I have a very special guest, Anna Chukaeva. And Anna has a very unique entrepreneurial experience, and I want us to learn more about it. Anna, thank you for coming.
It's a pleasure to be here, Olga.
So Anna, before I talk and we talk about your entrepreneurial experience, I know that you have an MBA degree from Stanford. So maybe could you talk a little bit more? Why did you decide to go there and how did it help you to build your path?
Definitely. Yeah. I always wanted to go to Stanford. The way Stanford looked from Russia, where that's where I was made and lived for a few years before doing an MBA. I was thinking there are so many cool labs at Stanford, and they're doing transformative science, and MBA is going to help me take some of those projects and take them to market. I realized MBA is not exactly focused on that, but what it definitely gave me is the ability to pursue what I want to pursue. There's plenty of resources, amazing classmates, great network, and they also had a hospital, which will be important in my story.
Sure. So you have been working as a co-founder, COO, and president of Carta Healthcare for 6 years. It's a healthcare startup connected to Stanford Medicine, I guess, at some point. And yeah, the company raised $43 million. It's wow. Uh, like it's even in Silicon Valley. Wow. So could you please talk more about how did you end up in this startup? Whose idea was that? A little bit about that.
Definitely. Yeah, as you know, I was looking for a tech project or something I could start or bring to market. I had previously started a company in arts. I loved the startup journey, and that was my goal. That's what I wanted to do. And I met a professor. He was a former mathematician, just like myself. And he shared that he is now using his mathematical experience doing models to model healthcare operations at Stanford Children's Hospital. And I was very curious. And at Stanford, I could take a class with him, which basically meant I needed to make a prediction model for supply usage in the operating room. I got to shadow cases. I got to talk to nurses. And that's how it all started. I thought, wow, there's a lot of opportunity to do workflow operational improvement in healthcare. We pivoted several times. In the beginning, we started with supplies. We figured out for many reasons, supplies are not necessarily a scalable thing. And we did workflow operations. I'm happy to tell you more exactly what that is. The funding obviously was different as it was now, as it is now. We had an opportunity to buy a company for which we raised which is not something, well, obviously you could still do that, but it's a little bit more risk-on environment than it is now, if that makes sense.
And what's the use case of Carta Healthcare? Who were your clients? What was the business?
Totally. Yeah, as I said in the beginning, in we were working with predicting what supplies are going to be used in the operating room, which is kind of funny. You would think they know, but that's a little bit more complicated. Basically, in academic medical centers like Stanford Children's, they want to use the latest tools, and nurses don't necessarily follow surgeons in terms of what latest tools they want to use. They remember that last time this surgeon and this procedure, that was approximately that. And then when they actually use things and they record it. And you can use that recorded data to predict what's going to be used the next time. But not every hospital is an academic medical center. So we explored that idea and we pivoted to something different. Hospitals need to report data on quality of care for a lot of different reasons, regulatory and internal quality of care monitoring, quality of care improvement. And they do that. One of the ways they do that is submitting data to clinical registries. Clinical registries are organized around a specific patient's journey. Let's say all the patients that have the catheterization procedure that meets those requirements are going to submit to this registry. And that's an intense process. It could be from 100 to 500 fields, depending on the complications. And that's the use cases we went after is retrospective data. So the data has already been entered by somebody clinical or somebody administrative into their electronic health records. We worked with Epic. Epic has a lot of market share. We worked with other systems as well, but that's where we started. And then what they do is instead of automatically pulling that data that's already digital into those clinical registries, that is hard for many reasons. They use people, nurses. Basically, a nurse would open up a patient's chart and they will copy paste. We thought, it's a great opportunity. Let's automate that. And we went into this. We realized, well, not that easy. It's not just copy paste, of course, because a lot of data in the clinical notes. So you need to deploy an LP engine, which we luckily were very well positioned to do. And the data is not necessarily in one place. There could be multiple places that conflict with each other that have the same data, so you need to make a determination. And another thing that is important there, if let's say you have a primary diagnosis, and then you have 5 clinicians in the room, that produces 5 primary diagnoses, right? So you cannot fully automate that process, but you could get a lot there. That's a problem. So with all the hospitals, that these are our main customers, and within the hospitals, it's usually going to be quality department that we are going to talk to. That is the business.
Sounds cool. You had multiple roles in the company. Can you tell more about your roles?
Yeah, in the beginning, well, founders do everything, right? In the beginning, the plan was that I'm going to do sales, partnerships. That was something I wanted to do. I wanted to be on the business side. And I did it for a bit, but then it became clear that we need more on the engineering side, especially when we kind of realize the extent of the complexity of the problem, that you have multiple data sources in multiple places. You need to keep track of them, and it differs from hospital to hospital depending on workflow. Where you record in Epic the data is, well, where we need to get it from, and it differs. So we realize we need a serious product. We had engineering talent, but I moved to running our engineering team and our product team, and I did it for a while. We had local team, we had team in India, we had a person in Palestine, we had Brazil team. So the idea was, and it did work like that. We had 24/7 development cycle, and that meant for me that I need to be up 24/7. It was intense. Yeah, that was what was my focus for the most part. It certainly was a lot of fun, not something I expected to do, but yeah, it was fun.
You were on it all the time.
I was.
For a company to raise that much money, what are the milestones for a health tech company to raise that much money?
Oh, I think it's certainly different, right? I'll tell you a little bit more about uh, our, you know, our journey, right? In the beginning, it was 2017, 2018 when we started to raise our seed. The market was different. We needed to demonstrate a big market and several letters of intent with hospitals, and we felt we were able to secure funding. Then, then what happened? What happened is a catch-22 problem in and this is very specific to not to all healthcare startups because there's wellness, it's out of pocket, there's people who sell to payers, there's all kinds of things, right? This is something that is true about the uh, startups who sell into healthcare providers, especially, big hospitals. And we needed a big hospital because we started in cardiology. So the registries were cardiac registries, and our clinical advisory team was also mostly cardiac. We had other advisors too, but the trick with hospitals is you come to a hospital and say, do you want to be our first client? And the hospital will say, no, absolutely not. Go get, a couple more other first clients, preferably marquee institutions, and then, I'll try your product. And that is sort of a catch-22 situation. So it's really hard to get around. So what we did, we found another company that had a software product that sold to a few customers, including big names like Stanford and UCSF, and they had a VA contract. What we did, we merged with that. They had revenues, so that enabled us to secure, further fundraising, right? Because because of that, this is still, I think, a cool and valid strategy for doing things as of now. But the main thing for us, it got us revenue, it got us reference customers, and it enabled us to kind of circumvent the catch-22 problem. Yeah.
Very smart. So how does a company that has, I don't know, $43 million and it's a healthcare tech company, how does it spend money? Like, I mean, in terms of marketing or maybe the product, technology, sales.
Well, certainly it doesn't have $43 million at any given time, right? It raises money, it spends, but we certainly had budget. A lot of this for us, and then certainly depends on the company's life cycle, right? In the beginning, we needed to build a product. A lot of that was R&D, right? And for us, building a product doesn't just mean engineering spend. As I mentioned before, you can't automate everything. And on top of that, if you want to build an algorithm that gets you the data that you can trust and goes to the right place, you need the source of truth. And the source of truth for us were clinical data abstractors, nurses that worked for us and supplemented our tech. And that's from who we learned. So that is also obviously a cost for the organization. And then of course, and that was in the beginning, that was most of it. As we got clients, we started to spend money on sales. We had one of the investors push early to do marketing, and that's just not what we did. Because in the beginning, when you have a few clients, yeah, you need to do sales. You need to use your network. You don't need to raise brand awareness. That's a very long-term investment. That's not what we did. So in the beginning, we did sales ourselves, so we didn't really need to spend a lot in sales yet. When we got our Series A, that's where we really started allocating sales budget.
Mm-hmm.
Yeah.
How many salespeople did you have after round A? Plus minus.
Plus minus. So let's see, we hired um, the chief revenue officer, and then they hired two lieutenants, and then there were two, three, I think, we hired one, then he quickly brought in two more people, then we had sales ops, so maybe six, half a year after, something like that.
Mm,
Maybe more, something like that. But um, we also had, there's the sales process, right? Depends where on the funnel you go. So we called them sales ops. They're a little bit further on the funnel because for us, we do clinical registries. We know exactly who submits to those registries. And we can approximate the case volume. So we know who those people are and how to find them.
mhm,
So that helped us a lot in terms of finding our customer.
mhm.
Yeah.
Sounds cool. So Anna, now you are a principal at an investment fund, Alta Holdings, and could you please talk more about your day-to-day role?
Well, uh, I actually also work for one of our podcasts. It's a biotechnology company, and we were working on a few IP transactions. Uh, that is something that is really interesting to me. As I mentioned before, that was my inspiration to go to Stanford. I always wanted to do technology transfer. So I'm kind of learning more about this world. And another part of my role at Alta is doing due diligence on the private equity and hedge funds that we're considering investing into, which kind of goes into my days in finance at Credit Suisse. It's fun, but certainly in the future, I am looking to build more in terms of companies.
Nice. And my last question will be, I know you are very interested in female founders and you organize events. Can you talk more about that?
Yeah, as coming from Russia, I thought that the um, days of patriarchy are over in my life. And having this experience here, I want to say that it's still harder to be a woman. It's much harder to do that. And it's very hard to be a woman founder. And the reason for that, I think, is, um, well, in terms of the capitalism, it's about assets. It's about the amount of assets that women control directly. That is something that I think will change things. If women control more assets, they will have more ability to change society. And that is why I support female founders. I want to see more women having successful startups, having more assets. And obviously, I can't support everybody in the world, but I am building a group of repeat founders like myself because I think, you've done it once, you've learned a lot, you're in a way better position to build something again.
It's very motivating. I hope female founders from all over the world can listen to you and be motivated by your
I hope
journey.
so.
Thank you so
I
much.
hope so.
Thank you.
Appreciate your time.
Thank you.